Welcome back. And same as over lunch, lots of interesting conversations going on and lots of networking, which is, of course, also the aim of such events, that you can communicate, meet, exchange. So you can definitely continue doing that after our session starting now. We're now going to look at the third theme of our day, and we're going to discuss the cross-cutting issues of the One Health approaches. And more specifically, for the first part, we're going to look at social sciences and humanities, but with the role of data. And like before, of course, you're going to be able to send your questions through Mentimeter with the QR code and continue rating the recommendations if you haven't done so yet, unless you do it session by session. So we also have recommendations for you to vote on this particular topic. I'd like to welcome the three discussants who are going to particularly look into that issue of data. And please welcome Salome Bukachi from the University of Nairobi. She's also a member of OLEP. Pekka Jokelainen, she's from the Statens Serum Institute in Denmark. And Jocelyn Tuillier from CNRS in France. So welcome to all three of you. Please take your seat. And I think, Salome, you're first on stage, or Jocelyn, you want to?
Yeah.
Yes, please.
Yeah, thank you very much for the invitation, and thank you, Salome, and thank you, Pekka, for coming. First, as a group, we would like to thank the invisible hand behind this meeting. So we would like, they have surnames, so we would like to thank Anne, Eric, Thierry. So please, thank you and congratulations to them. Look at this room; it's really a huge event, and thanks for the opportunity to be here. Secondly, today we will talk about social science and humanities, and we will talk also about data issues. So I will take, as the moderator, the floor on the first topic, and next we will move to the second topic, the data considerations. So let's start with the social science and humanities and data. First, let me remind that we also acknowledge the contributions of many colleagues here that contributed to these recommendations on these two parts. And also, let's remind that social science and humanities are not just one discipline. They are multiple. And if you move from archaeology, for instance, or mathematical social sciences, it's like comparing genetics and psychiatry, so I would like you to leave this room with this in mind. Secondly, we define 4 recommendations with the group. The first one focuses on territories. The French notion of territories cover place-based social and space territories, and they recognize rural, peri-urban, and disadvantaged areas as strategic levels to implement multi-level strategies and to also take into consideration the multi-level structure of governance. So we need to be humble inside this. We need research in this area. And we need a lot of research for the ownership of local governance to appropriate the concepts of the One Health approach, because we have One Health framework, but the realities are diverse, the territories are multiples, and therefore we need to recognize this heterogeneity. The second challenge are inequalities, so we need to systematically integrate social, territorial, and gender inequalities within the human being, of course, but also across species. And we need to identify systematically these inequalities to build policies and to take into consideration the marginalized and the poorest people in multi-crisis context. Thirdly, we need to have decisions. So we decided to focus on decisions, and social sciences can help build friendly tools to help decision makers, to help policymakers, and to help local authorities to incentivize good behaviors, appropriate policies in order to integrate the scientific data based on evidence, but also to evaluate and to make public policy evaluation along the way. Lastly, we identify ethical foundations and legal issues as a major constraint, and we think that we should formalize these ethical foundations in order to move forward on the One Health approach, not only to help decision makers, but also to constrain some of the behaviors that could have negative spillovers or negative externalities here, and therefore help managing the future health crisis. So these are basically the 4 goals that we wanted to emphasize on the social and sciences and humanities side. And I will leave the floor now to Pika.
Thank you. I'm very, very happy to be here, and it is my pleasure to present one slide that shows the recommendations for data. And I would say one health, one science, one data. So starting points, where are we now? I mean, a lot of data that are relevant for One Health exists, but often these data are fragmented and scattered and behind barriers or somehow not so easily findable and usable. And maybe they are in the silos that don't have the bridges across them yet. And key thing is that these data are often underutilized. And One Health approach, that is the key, how we can unlock this situation and connect the different data streams across sectors, disciplines, and actors. And this way we can create One Health knowledge, One Health insights that are very often directly actionable. So to connect those data streams, what do we need for that? A key word is interoperability. We need improved interoperability across different data systems so that they can work together across. We need shared standards, identifiers, metadata, so that the data can be found, can be understood, and can be used for integrated analysis. And we need to co-design collaboration structures and frameworks for data. And in this, it's very important to discuss and focus on trust, fairness, and recognition, for example. And I think this is the reason why it's wonderful that we have the data and the social sciences together, because the data streams, it's not only a technical exercise, it's about working together. And bringing it together, making sure that we are making One Health data a practice. And this practice can be first by initiatives, piloting, building structures for that, but also just doing it. It's about our behavior. And important for this event here these days is also that we enable and encourage to use the data and show what One Health data can do. And indeed, the key we have the key for that, that is the One Health approach, One Health and One Science.
Thank you very much, Pika. So now I would like to move on to some specific examples. So Salome, can you tell us about your experience in the co-creation with communities and the relationship also with One Health work and One Health framework?
Thank you very much, and it's a pleasure to be part of this panel, to just share some of the experiences that I've had, especially working within the One Health space and within a multidisciplinary, transdisciplinary groups. So to help anchor the social sciences within One Health, I would like to give a short experience of my working with various disciplines in a project that was looking at research implementation on livestock and human vaccines. So there was a day we were meant to go to the field to conduct livestock vaccinations as part of the bigger project. And so the lead of the team that day was a veterinary researcher. She decided to make a decision because she only had 2 vehicles and she needed staff who needed to go with her to conduct the vaccinations. So she decided to drop off the social scientists. She actually called me because I was not on the ground, but I had a team I was supervising. So she called me and told me that today we are not going with the social scientist because we're just going to vaccinate animals. And she needed to carry the technical workers who she was working with, the technical team. And so she dropped off the social scientists. Much as I told her, I think it's still important to carry the social scientists because it's an implementation research. We are still collecting data, and it's important that we also document what is happening on the ground. But she insisted that no, for today, we won't go with the social scientists. And so she and her team went to the field to conduct the vaccinations. Already mobilization had been done a week prior to the vaccination. The community were already alerted about where the vaccination point would be. So what was required was that the community members would bring their animals at the point where the vaccinations were to happen. So they were in the field very early, by around 8. They were already at the point, the research team was already at the point waiting for the community members to come with their animals. 8 o'clock, 9 o'clock, they're not seeing anyone. 10 o'clock, and they start getting worried. What's happening? They thought they mobilized very well. Why aren't people coming in? At around 10:30, they started seeing individuals, one by one coming, and these were elderly women huddling their goats to the vaccination site. And the veterinary was surprised and wondered, why is it the elderly women who are bringing the animals? Where is the rest of the community? And so as a result of that, she started reflecting that this needs the social scientists to come and tell us what's happening. Why is it that people, the rest of the community are not there, and it's only elderly women coming with the animals? So she quickly called me and told me that, please mobilize the social scientists. Tomorrow we are going with them to the fieldwork. So what did we find out? We realized that in that community, the men have migrated out of the area because that's an arid area, so they've gone out to the main towns to look for work. The women in their productive age groups have gone to work in the farms or to look for jobs within the vicinity, while the children are all in school. That helped us to understand why it was only the elderly women coming. And of course, we know the workload that then remains on that elderly woman to bring the animals to the vaccination site. So this brought about gender issues within the community. It brought about aspects about co-creating with the community to know when is the right time to do these vaccinations. Normally in that community, it's children who help a lot with the labor of animals. And when it's a school season, they're all in school. So the best time to do it would be when the children are off school, either on the weekend or during the school holidays. And that made the researcher, who is a vet, come to realize that there's so many social gender issues within just a vaccination, a technical aspect. And so what do we realize from this is that there are cross-cutting issues that are important to take into consideration when dealing with One Health, and co-creation with the community is very important. Many times we also study the behavior of communities, but we forget to study our behavior as researchers. And this is very critical, to study the behavior of researchers, even the health workers, when we're dealing with issues of One Health, because that will help us identify areas which need intervention or which need further sensitization or training to help people collaborate in a way that is equitable. So aspects of also just understanding about communities, that there are sometimes vulnerable communities, marginalized communities, or indigenous communities who may be left out when research is being done. And so finding strategies on how to bring them on board to ensure that their voices are heard. And so within the social science space, we help to bring about the lived experiences of these communities who may be isolated. We bring into consideration the needs of various communities across different cultures, across different regions, because as has been said before, even in various platforms here, one size does not fit all. It's important that we customize our interventions to all those different areas. And as we look at aspects of also equity, it's important that aspects of equity and social inclusion are important, and social scientists are able to help us address these issues of equity and social justice. And as I wind up just my intervention in relation to the case study, there's the aspect of also data. Social science collects a lot of data, and this involves both qualitative and quantitative data. So we have the social observatories that also exist where data is collected on a continuous basis. And one of the key things that we need to ask ourselves is, how do these social data also get integrated when we are doing surveillance? Because these are critical points to be considered. And based on that, I would like to hand over to Pika to tell us more on how she can integrate the social sciences also within the data sets.
Thank you so much. Indeed, I think this is still the type of data we need to do more work on integrating it. So my practical example that I'm bringing to this discussion is my experiences from working in leadership roles to coordinate building One Health surveillance systems for emerging and re-emerging zoonotic diseases. And I think this is really a topic where we understand the complementarity of different types of data sets and also kind of like where they come from, but the social science aspect could be and should be more integrated in this. Typically for my work in infectious disease preparedness, we don't look so much on the behavior of the humans, even though that's often is both can be a problem and a solution, but it's more looking into the different compartments or domains, humans, animals, and environments. Very practically, it's typically collecting samples and testing them for the pathogen across these domains, optimally with methods that are harmonized, so that helps with bringing data that is easier to integrate and look across. Bring the data together and analyze using integrated approaches. A lot of the work nowadays is sequence data, how we can look at that, and it really doesn't matter if the virus sequence comes from human, animal, or environmental sample. But more and more there's the work to integrate these simple laboratory result data sets with, for example, climate data, but also for the social sciences work and those kind of data. Especially when we need to understand why something happens, why we can see a pattern or a change in the epidemiology. Key parts of all this is also communication and sharing the data to relevant stakeholders and actors. And in my field, very often that needs to happen fast, very quickly, because the surveillance we have aims for early detection and often then rapid response after that. And for that, it's very important that collaboration structures and communication pathways have been established already, because you need to know who you are going to call when you have the results. And my very concrete example of impacts of One Health data comes from an ongoing project that I'm coordinating called OH for Surveillance, so One Health for Surveillance. This is an EU co-funded project where 11 countries are collaborating to strengthen and piloting and building up One Health surveillance components for zoonotic pathogens. And this project is not alone in Europe. It's part of a cohort of sister projects across different countries doing similar work. And this is a really nice way of working together and sharing. And in the very first year of this project, 2 of the countries made their first detection of an emerging vector-borne zoonotic pathogen, West Nile virus. And this is quite something. It immediately shows that it's very useful, because in both countries, Estonia and Latvia, this detection was done before there had been a locally acquired clinical case in humans or horses. So it was really an early sign, early warning signal. And why this is a success, or why this little finding can have impacts, is that it was happening in this framework, and there was the governance structure in these projects, and for the cohort of the projects done together with the European agencies, EFSA and ECDC. So the data was, of course, relevant locally, very important, but it was also relevant for the neighboring countries, and it was also relevant at the European level across the sectors. And this, that there was this impact pathway, there was possibility to share and use this data very quickly was really the key. And I mean, it was just nice to show, like, okay, that was a good investment already by their project continues still. And I think that's a nice, like an example also that was highlighted by a previous panel, that data evidence are generated, but is it used and how is it used? And I think there also the link between data and social sciences is very important.
Thank you very much. So, making the link with behaviors in economics, we decided to take also other examples. And of course, the data issue is important to co-design with public evaluators and help decision maker to take decisions. So if I had to take 3 examples on the behavioral or economic side on the trade-off that we are making, maybe the first example will be going back to early field works that I made in Mali, in Africa. On malaria control. At that time, there was a huge drug resistance in the fight against malaria, and economists contributed a lot. I'm an economist, so economists contributed a lot to design the optimal subsidies, to deliver benefits, and also to provide artemisinin-based combination therapies. But other social sciences contributed a lot also to in social marketing in order to promote the use of bed-nets, and this enabled to halve malaria in about 10-15 years. So this was success that is now put in danger by new resistances again. But this indicates that behaviors may matter, and social sciences can help in shaping, as I said, good ways or incentivize or promote appropriate behaviors. The second example that I would like to take is vaccination, because vaccination is the typical example that we give to students in social sciences, and you can see vaccinations are a specific trade-off involving a lot of beliefs, involving a lot of uncertainty as well. And therefore you can include individual decisions into epidemiological models. This is where social sciences can contribute. You can also see behaviors there in terms of the management of the public good, because vaccination generates externalities, and people, either farmers or individuals, pay the cost, bear the cost, but the benefits are shared by the society. So this is a concrete examples where we can help in helping decisions, and also tackle misinformation and this kind of issues. And lastly, the last example that I would like to take is antibiotics resistance. You know that we can innovate also in that way. So, for instance, I think last week the Nobel Prize Jean Tirole proposed a novel transferable patent system in order to disconnect the innovations on IMR and the sales and the resistance to antibiotics. So, of course, we can help in designing new systems for insurances, designing new patents to promote innovations and maximize the benefits. So this leads to my last slide before maybe taking your questions. And don't forget that inaction is costly. And of course, we know that zoonotic disease costs annually about $1 trillion of US dollar. And we know also that if you invest in €1 in prevention, you will be able to save 100 euros. There was a recent paper by Dobson and all in Science Advances, if I'm correct. And of course, you have a very small share of the national budgets that are dedicated to expenditures allocated to pandemic preparedness. It's about 1% in low-income countries and 3% in high-income countries. So we need to take this into consideration, to be active. Don't forget the return on investment, so probably prevention, as said in one of the very first slides, is truly cost benefit, and also be cautious that not to reduce One Health to economics consideration alone, and to take into account all the social sciences that we discussed today. Thank you.
Thank you. So we have indeed time for maybe one question. If I don't suppose you have sent questions through QR code for that, but if we have maybe from the front row, one question, not more. Front rows, I mean, you know, it can be from the back, but I can't see the back. Oh, we have a question in the middle. Do we have someone with a microphone? I'm not sure. Thank you, Pauline. We have somebody, if you go up, sort of halfway through, see the gentleman raising his hand there, and that's the only question we're going to take. To your left. And sorry, it was not a gentleman, but as I said, I can't see the back, so.
Thank you. I'm from UNESCO, Division of Water Sciences, and I'm very pleased to hear about the importance of science in the One Health approach. And I would like to highlight 3 points. First is the...
can you be brief, please?
Yeah,
sorry.
So, yeah, of course, I will be brief. So the first point is, we have been talking a lot about the silos, but I think the most important point of connecting the silos is the interdisciplinary science. So we have to really fund research and science that the scientists between the social and environmental and health sciences work together on joint projects. So this is important. Secondly, I think in the data collection and unlocking the data, we also have to engage the citizens, and citizen science has a really important role in contributing with the data, and we, UNESCO, also contribute and promote citizen science and environmental observations or water quality monitoring, and they can really play a double role, not only collecting data, unlocking data, but also raising awareness. Third, there was a question about the science and policy interface. We have enough evidence, scientific evidence, to underpin policies, and we really need to make sure that the scientists talk to policies, not only publish within their scientific community. For example, in this scientific colloquium, I don't see any policymakers, and we really need to make connections between the two communities. Thank you.
Thank you. That was more of a comment than a question, but if you'd like to comment on the comment, very briefly, please.
Yeah, so just to quickly comment on the comments, I would like to draw our attention to the principles, the underlying principles of the One Health definition by OLEP, the One Health High-Level Expert Panel. The principles embrace aspects of equity, socio-ecological equilibrium, socio-political and multidisciplinary parity, transdisciplinarity and multisectoral collaboration. And this is across disciplines, across communities, across different layers, the policymakers, and bringing everyone on board, and including even knowledge, other forms of knowledge, not just the formal knowledge, but the informal knowledge and the indigenous knowledge into the whole process. And if we embrace those underlying principles, those would guide how we operate within the One Health approach. Thank you.
Thank you very much. Very clear conclusion and very clear answer. So thank you very much for that, and thank you for joining us for this special session. Jocelyn, you wanted to have a... No? Okay. So thank you all for joining us for this session. So we will now dig a little deeper, or maybe from a slightly different angle, into the issue of cross-cutting in relation to, or cross-cutting issues in relation to One Health. And we will look at the scientific basis for a paradigm shift and effective science decision interaction. To do so, it's my pleasure to welcome Carlos das Neves. He's Chief Scientist at EFSA, the European Food Safety Agency.
Thank you very much, and a very good afternoon, mesdames et messieurs. It's a very robust title to talk about governance. But before we actually get to governance, and it's moving a little too quick, so let's slow down. To talk about governance, I'm just curious, is anyone here on their first One Health conference? Anyone brave to say they're on there? So this is really good. This is really good. So first of these slides are perhaps for you, because I wanted to tell you a bit this story, and I also want to recognize the work of our hosts. So I want to tell this One Health a bit à la française, and because of that, I thought the best way to tell this story was to go on to my own childhood and show you some of my favorite comics, which is of course Astérix. So we take this trip with Astérix in Lyon, and if you have seen these books before, you know how this story always starts. The year is 2026 after Jesus Christ. The entire planet has been conquered by threats. All? No. Because one small village by the Rhône, with indomitable One Health supporters, continues to resist. And the life isn't easy for the threats that are camping outside in the different garrisons of Pollutium, Cibus Malus, Pandemium, and Antimicrobialis. For those of you who have just joined this One Health, if you drop by our village on any good day, you will see a bit of this. You know, sometimes we fight a bit with each other. Who comes first? Who is most important? Who should get the money? Can be a bit of a normal village. But we do have a secret. We have a magic potion. And the difference with this magic potion is that we know very well the ingredients. There are only 3, because with 4 it could be a UPF, and then it's complicated. But there's 3 ingredients, equal parts of knowledge from every participant. The scientists, the policymakers, the different disciplines, it doesn't matter. Equal parts of resources, sprinkled with a little bit of Euros gold dust, just for flavoring. And when we get this magic potion, we are absolutely invincible pour tout à tis. And this also needs strong governance, which means strong leadership. So I should also share a message from our chef de village. And he has been very clear in what he has said about One Health. And I just want to highlight perhaps 2 aspects which are key for thinking governance. The promotion of research innovation and a science-based approach, and the importance of a multilateral approach, etc., especially when we are in face of temptations of isolationism and fragmentation. And I think we can all agree that science and multilateralism have been having a few hard days in the last years. So, when you reach 4:30, we've already covered a lot of the One Health pillars, and we focus really on the governance and this transformative change that we want to bring into the discussion today. What is the dream? Well, I think easy. The dream is a magic potion that lasts long, that is not short-lived. But when you want to bring everyone together, every discipline together, every thematic, we also have a transformative challenge, and that is complexity. Making space for everyone at every level of governance. And this is not easy. But this is, of course, a challenge that a lot of colleagues have been working hard with to try to come up to good solutions. And I'm happy to tell you that our French colleagues, and with the support of some more of us around the world, have indeed come up with 8 recommendations. You will actually see them a little later today, 7, because 2 are merged. They are in a slightly different order than you see here, so apologies for that. But these are the recommendations that we are collectively making. And they cover different areas, many of them known to many of you, I'm sure. And rather than explaining them in detail, you'll get them online at 6 o'clock, I've heard. I just want to leave in the air a few things which I think are still difficult to reach as we go from recommendation to recommendation. But first, let me tell you one thing, which is called alignment. It's a very complex picture. You don't need to worry about the details, but it shows one thing. This first year, these 8 recommendations launched today, they are perfectly aligned with 10 others we made a few years ago when we launched the Lancet One Health report. And I'm sure Andrea Winkler will join us in a bit, we'll speak more of that. And they're actually very well aligned with the 3rd column of recommendations made by the European Union One Health governance recommendations. And these ones are also, by the way, being implemented. I'm perhaps biased. I'm the chief scientist of an European agency, teaming up with another 4 on a task force for One Health that does the groundwork. And we are even aligned with the last column, which are recommendations made by policymakers, for policymakers in One Health. This was last November, the first time we got them together to speak about One Health. You would see that the yellow lines don't reach the end. That's funding. They were smart not to talk about funding. But they are aligned. So if we are all saying the same story, it must be right. Why is it not moving quicker? And I'll just leave in the air a few thoughts using a few of the characters of this comic book. First, we speak about integration. And here I'm, again, a bit biased since I'm a wildlife researcher, so I bring the famous sanglier, probably the most seen character in the books, but always ends up bad. And one could not wonder if this integration is happening as it should. We all start this sentence of 70% of emerging diseases, blah, blah, wildlife. It's the way we all start this conversation, but then when we talk about integrated surveillance, conservation approaches, better use of these food resources and better regulation, the wildlife fades out of this integrative approach. When we talk about impact, Obelix always brings 1 helmet for each Roman he knocks. But one of the questions I get from politicians is, does this work? And do we have sufficient good case studies that show it works? Do we have the metrics in place? This is essential. We are also recommending that we focus on health systems. And here, I cannot but to say, have we learned the lesson from the last? By the way, that's Asterix. That's not AI made, huh? It's Asterix in Italy. 2017, he managed to vanquish the coronavirus. And so did we, thank God. But are we missing in this health system aspects linked, for example, to environment and nutrition when we build new health systems? Let us continue quickly. When we come to policy, science to policy, and putting also One Health in international regulations, and on that part I just say stay tuned. OLEP is working as well on this aspect of One Health in international treaties and regulations, and it will soon be shared with everyone. But I wonder, why are we sometimes slow in implementing? And we've talked that the GPA is in place, it can be rolled out. Why does it take time? Is the complexity a problem? We want to do this at international, national, regional, local. We want partners, private, public. This is difficult to articulate, and it can slow us down. But last but not least, I'm also putting here the question of the missing ambassadors. Are we talking a language that these ancient and noble policymakers understand? I mean, many countries have the ambassadors for global health, ambassadors for the environment, ambassadors for biodiversity. Are we missing here some people that can spend some good time focusing in explaining this to those that need to learn it? And for education, I put another very famous, because I think the real star of this One Health Village is not Asterix, it's Obelix. And you should all know why, if you know the story. He fell into the magic potion when he was a baby. And he's the only one in the village that doesn't need it. He's always ready to put One Health in action. So I cannot wonder if in education we are also picking the thread too late. Shouldn't we be starting this much earlier? And even if you're doing it later, are we still stuck on this, I used to call it the Holy Trinity, the doctor, the vet, and the environment? These ones we need to educate. What about the economist, the journalist, the politician? It usually helps. Let's see tomorrow. So what can we do here? And of course I add trust and information, because as we've mentioned earlier, multilateralism and science have been challenged in the recent years more than what I think many of us would have liked. So the last recommendations takes us to two more examples, and this one is the knowledge pluralism, having everyone on board. And of course I bring Assunção Torix, the bard, who is never allowed to speak. And are we still silencing some voices? Are we listening to communities? Are we listening and including traditional indigenous knowledge? And do we have the right people also and the right type of leadership in spaces? And there, of course, you see here perhaps a futuristic but more efficient way of leading the small village. And don't want to talk about money, but the last one is, of course, running after the cauldron to say that funding is always an issue. Rather than just talk about why we need money to do One Health, have we properly assessed why inaction is costing us money? And in the interfaces of One Health, are these hidden costs something we should address? I work with food, so not surprised that I speak of hidden costs of food in the environment and in health. Have we made a strong enough case? My last slide, and thanks to Bruno, I am no longer the lonely rider on this, is what many perceive to be the biggest challenge to the governance, called the silo. And you know, you can spend years trying to break down your silo. It's hard work, it will take your energy, and at the end, you just have a smaller silo. And suddenly, the neighbor is bigger than you is a problem. Not to mention, you spend most of your time actually destroying the neighbor's silo. So here I'm proud to say, in our village, we have a different approach, and it's really this connecting and bridging silos. But bridging silos takes courage, takes time, takes resilience. The bridges are, as you see, quite high, so if you're afraid of heights, it's difficult to cross the bridge. And most important, these bridges, they rust and they get torn down really quickly. So you need to invest in making these bridges stay. And that's the message that I would like to leave, that governance starts at the end with every one of you. So as you leave this room, if you meet someone you haven't met, change your LinkedIns, connect, make these bridges, because together we are stronger and the petite village will succeed. Merci beaucoup.
Thank you very much. And please, do take a seat, because you're going to be joining the panel now. So let's move on to our panel discussion to continue on Asterix and to see what's happening in the village. And to do so, I'm going to invite our moderator for this session. Please welcome Richard Horton, Editor-in-Chief of The Lancet.
Thank you, Franz. Well, thank you so much. It's been a long day, but now you're going to be entertained by the best panel of the day. It's appropriate, actually, that we're holding the meeting today on the eve of World Health Day, which, if you've had a sneak preview, is focusing on inviting all of us to stand with science. And this program for this panel, of course, is dedicated to effective science-based decision-making. Now, as an editor of a science journal, I would love it if every paper we published had an immediate impact on practice and policy. They never do, or rarely anyway. And of course, just like life, policy is non-linear, and that's what we're going to explore in the next 30 or 40 minutes or so. How are we going to shape the interface between science and policy? How do we incentivize political change? How are we going to mobilize civil society, engage the private sector? How do you hold decision makers with power accountable for their promises and commitments? And how are we going to make the laundry list of recommendations that you've seen today become reality? And for all of the answers to those questions, please welcome our panel. Let me introduce them one by one. First, Professor Andrea Winkler, come up, please. Andrea is Director of the Center for Global Health at the Technical University of Munich, and she was one of the co-chairs of the Lancet One Health Commission. Andrea, great to see you. Christian Walter, please come up. You are Executive Director for Health at the Wildlife Conservation Society. Next, Barbara Heisler, who is a professor in agri-health at the Royal Veterinary College in London and also a member of the Lancet One Health Commission. Magda Rabalo, Magda, please come up, from Guinea-Bissau and president and co-founder of the famous Institute for Global Health and Development. And last but not least, Ariane van der Strappen from DG Santé, and she's head of unit for One Health in the European Commission. Welcome to you, Ariane. Now, what we've said is each one of our speakers, panel members, is going to have 3 to 4 minutes to give their reflections on this interface between science and policy, and then we're going to take some questions from ourselves and the audience. So let's start. Andrea, it's great to see you. Your 3 to 4 minutes starts now.
Great to see you too, Richard, and thank you so much. It was just fantastic, Carlos. I think we have to, there's quite a bit of confusion here, and we have to disentangle that confusion for the policymakers. We do have a very good evidence base that we collected throughout 7 years, being distracted a little bit by the pandemic. And I also would like to welcome my good friend and co-chair of the Lancet One Health Commission, John Amwesi, who's somewhere there. So, and of course also Carlos and Barbara here, and also Professor Carabin. They have all been commissioners, they're all here, and others. So thank you so much. So we do have a good evidence base, and 10 recommendations, almost covering everything, with good roadmaps, who should be doing what by when. Please do consult it. It's easy to access, but I think policymakers do not really know about it. And we do not have to reinvent the wheel all the time. I think we need to endorse what we have. Number 2, there is confusion as well, conceptual confusion. So where does planetary health actually fit in here? I haven't heard it, not even a single time today. What do those recommendations refer to? Where, as a policymaker, can I apply it to or apply it for? I only hear infectious diseases, AMR, but the elephant in the room is NCDs, non-communicable diseases, brain health. They are applicable to those as well. And last but not least, Richard, I think we need good One Health literacy and also competency also for policymakers. And that maybe we can detail in another round. Thank you.
Fantastic. Thank you very much indeed, Andrea. Christian, you're next.
Yeah, thanks very much, Richard. Good to be here. So I've been quite thrilled this afternoon. I was listening into the various panels, and one of the things that really got me today was the number of people who pointed out compounding impacts. So this is something that's really shifted in the last year. I unfortunately have been in many One Health meetings over the last decade, I would say. And very rarely have we heard of compounding impact. So this is a real great shift. And if you may, I'm just going to move to sort of infectious diseases for a short second, because I know Andrea is going to defend the non-infectious diseases here. Anyway, and as I focus on this, I just want to point out that from a system science and One Health perspective, we really appreciate where risk is occurring. It's obviously at the interfaces between livestock, humans, and wildlife. And it's at these interfaces where risk can either be increased or decreased. And they're not really isolated events. They're systemic failures that are happening at these interfaces. However, our behaviors, our practices, and our policies completely ignore these very blatant risks that we face. And some of these practices that we have are simply silly. It is 2026, but we still insist on trading live wildlife in large urban centers. Honestly, that's like doing gain-of-function experiments in a public space, right? And that's not an exaggeration, by the way, right? If you ever try to get a permit to start a wildlife market as an experiment, you would never get one. Mink farming. Why on earth in 2026 would we allow a large mixing vessel for coronaviruses and influenza viruses to persist? So just to sort of finish this short statement is, in contrast, there was a representative from UNESCO who made a comment in the panel just before, sort of pushing towards scientists that are not communicating and only publishing journals. I really want to push back hard on that. All of us here on this panel, and many of us have been on panels before, spend a lot of time communicating, not only in scientific journals. We would always love to publish exclusively in the Lancet. It's not the reality. We spend a lot of time. On the other side, though, are the policymakers and decision makers, who, as Andrea pointed out, need to be educated, but they also need to be prepared to listen, and as Carlos has pointed out, to overcome the short-termism and the discussion. So I think that's something we can address further on.
Thanks very much, Christian. We'll come back to some of these questions in the Q&A. Barbara.
Thank you, Richard. Great to be here. So I'm going to start first with a little bit of success. When colleagues and I started working on the economics of One Health about 15 years ago, there was very little information available. There was a lot of talk about the proof of concept. There were a lot of benefits that were described. But overall, there was little quantification and little evidence and standardization available. And this has really changed in these past 15 years. We have more evaluation frameworks, we have more information, we know that One Health works, we have more information on the economic value. So overall, One Health has become much more tangible and has moved from a philosophy, as many people called it, to something that we can actually look at and evaluate. But of course, several gaps still remain. We have a lot of descriptive case-based studies. We have a lot of outcomes that are not measured in a standardized way. We have no universally accepted indicators or indices. And also we still have several gaps in the evidence. But as we have heard today already multiple times, these gaps in evidence do not mean that we should not act. And we can act with what we have available, and we can make changes, because the costs of inaction and also these hidden costs that we heard about multiple times today, they are vast, and they give us enough justification to act. When we think about the return on investment of One Health, there's always a call for more evidence on that side, to have something to give to investors, resource partners, to be able to convince them that investment in One Health is the right way forward. And of course, this argument is important. I do not want to dismiss it. But we also see that also on the economic side, we have increasing evidence that One Health does add value and that it can be a good investment. And just before, on the slide before, we saw some of these figures with returns of up to $100 per dollar invested. So with that, there comes the question: if we have already that evidence, and we're constantly being asked to produce more of that evidence, what is the barrier to make use of it and make the changes that we need? And I know that we could talk about that for a whole day, but I think one of the main things that we need to think about is the complexity, is what One Health does. Very often we see delayed benefits, we see cascading effects, we see feedback loops, and we see complex systems that we are dealing with and complex changes. So maybe we need to think about how, as researchers, but also as policymakers, we can think about these complex systems, the complex evaluations, and what that means for our decision making.
Thank you, Barbara. Magdi.
Thanks, Richard. I think the silos that we have seen from the slides presented by Carlos calls upon us to be able to look into One Health not only as a complex system that requires transdisciplinary, multisectoral, and interdisciplinary collaboration, but one that also navigates on the waves of politics, the power of politics, the financial and economic elements that are involved, and how knowledge sharing can shape the collaboration between researchers, policymakers, and communities. I want to believe that if the global health system would move right now, as we are talking about reforming the global health architecture and the governance of the global health architecture into incorporating prevention as a critical element of the next stage of the health systems 2.0 that we need, by bringing on board the socio-ecological systems that we need, that will go a long way in terms of moving One Health from the theory to practice and taking it from the confines of the veterinary services, or making a leapfrog by bringing global health more into embracing One Health rather than waiting for the next pandemic to occur. I want to believe that the talks around reform continue to be focused on infectious diseases. We remain very much around looking into diseases rather than looking at people, and that's why we continue not to focus on prevention. And equity is not centered because we are not talking about people. We are talking about diseases, bacteria, virus, parasites, etc. So we need to look into the politics, the power of politics that sustain One Health. We need to look into the economics of One Health. I've seen some data presented here, but it is difficult to translate to 1 trillion to a government of Guinea-Bissau for them to understand what does that exactly mean. So we need to take the knowledge into pieces in order for us to embrace that at local level and bring communities around. I'll stop here. Thank you.
Thank you, Magda. We'll come back to some of these points. Ariane.
It's on. Thank you. So I will start by taking some words of Carlos. So he mentioned the recommendations that have been presented by different scientific organisms, like, for example, for the European Commission is the SAM opinion. So it's our excellent chief advisor, who explained us a bit, gave us recommendations how to implement One Health. And I will pick one there. It's integrate One Health early at policy design stage. And one example of that is recently we have adopted a plan for health crisis on prevention, preparedness, and response. And there, really, One Health is one of the core pillars of this new plan. Then I would say in the EU and in the Commission, we have taken a pragmatic approach. Think big, start small, and stay concrete. And this is a bit also a quote during the last One Health conference in Copenhagen. Stay simple, be concrete. So let's take one example, which is the AMR one. First, there we set clear, measurable targets for measuring the progress regarding antimicrobial resistance, to reduce the use of antimicrobials in human health, animal health, and to link them. Second, and we have heard a lot about it, is the economic case. We continue to work on making the economic case with up-to-date studies. So we partnership with OECD to really see and demonstrate what is really the economic benefits of working in a One Health approach in for example, AMR. Third, we still struggle, I would say, at EU level to include the environmental dimension. So again, stay simple, see where are the issues. And for example, we spoke a lot about the importance of integrated surveillance. We published recently a report on that, but it's called the feasibility of integrating different surveillance data. So now from AMR, we have gained quite a lot of experience, I would say, across the years. We are expanding now and using the benefits of this experience to other topics like the climate and health nexus and like also the non-communicable disease. For example, we have adopted recently, last December, what we call the Safe Hearts Plan, where we can see how cardiovascular disease can be addressed in a preventive way, where when you take also into account different determinants that are either environmental, like pollution, linked to the healthy lifestyle, smoking, physical activity, healthy diet, and also societal. Then, as Carlos said, One Health is about inclusion. So, of course, we all know we need to work together, but let's make it real with coordination groups, effective networks. That's what we are doing inside and outside the Commission. Let me give one example in practice is the cross-agency One Health Task Force, Carlos mentioned already, which is an initiative from our 5 scientific agencies dealing with food safety, the one with medicine, the one with chemicals, the one with environment, and also the European Center for Disease and Prevention Control. And these task force deliver joint outputs across human, animal, food safety, and chemical safety. Joint outputs also were taking into account what happens now with bird flu, where you have really human and animal health information combined. And this really helps us to take a decision for policy development. I would also go into the citizen engagement. This is essential to maintain the political support. One Health must translate into visible benefits. Is it cleaner air, cooler cities, and of course, healthier lives? And for that, we are experiencing new approaches. So we have done a gaming issue. I don't see a lot of young people here, but maybe you have kids playing Fortnite. And there we had a game called Beat the Bug, which was really to learn to the young generation how to address some issues of antimicrobial resistance. And there I have also, I don't have asterisks with me, but I have another book which is called Sketching Antimicrobial Resistance, where you have 30 nice drawings from artists across all the member states. And this is, I would say, an initiative done by JAMRAI, which is joint action with the EU and all the member states. I know that now the exhibition is in Lyon until the 14th of April, so really don't miss it. And I will just end up now with 3 points about key lessons that we have learned. Of course, One Health requires investment. Political timelines are very short, but I would like to say one thing, and it was already said several times. One Health is not about involving everyone all the time, everywhere. It's about targeted collaboration. And there I can echo all the points that were made about silos. I will leave it there.
Thanks very much, Ariane. Andrea, you spoke the least. Even though you wrote the longest report on One Health. I just want you said the elephant in the room was non-communicable diseases. Give us 2 minutes on what you mean by that. Why should NCDs be part of this conversation?
Yeah, no, absolutely, Richard. So NCDs are super, and I also would like to quickly commend what Magda said. It's the person, it's the people. So, but of course, a person may have different diseases, chronic diseases, but also on top of, infectious diseases. Anyway, NCDs, 75%, as you know, Richard. I mean, global burden of disease, death are due to non-communicable diseases. And I think this amounts to 43 million, 18 million alone, less than half of that is actually premature. And then almost over 80% are happening in low and middle income countries. So huge inequity, first of all. And also, just as a concrete example, I'll just use what I know best is brain health. Prevention of the dementia. We know that by now it's at more than 50%. I know it's the 45%, but we are adding factors to it that can be prevented, and a healthy lifestyle is, of course, some of it, and also social isolation, exercise, and a lot of risk factors there, cross-cutting risk factors, diabetes, smoking, we mentioned it all. So all of that is amenable to a One Health approach. But who in the Ministry of Health actually talks to architects? Who talks to urban planners? So when we talk One Health, we always think infectious diseases. And if we can tune into a little bit into the NCD discussion, I think we could have a much stronger output.
Okay. I'm a bit of an outsider. I'm not a One Health expert, so I'm observing this conference and your commission and other activities. We've got One Health principles, we've got several conceptual frameworks, we've got declarations, pacts, networks, statements, commitments, calls to action, this rather fearsomely named quadripartite, this long list of recommendations, but we all acknowledge we're not moving fast enough. We all seem to acknowledge that the lessons of the pandemic have not been learned. Your list of barriers at the end, Carlos, was very sharp and incisive. So to the panel, what is going to make the difference to accelerate action? Let's go in reverse order. Ariane.
I think we need to go quick in passing certain messages to the politicians, so the time there is quite restricted, and we have really to make the case it works. So that's why I insisted to the fact that we need to show with certain topics where we have already evidence that the One Health approach is the good one to take. And then progressively, you can go to NCDs, which is much more complex still, because you have a lot of different factors that could influence. So make the case, keep the momentum, and try to be concrete with factual information.
Thank you. Magda, how are we going to accelerate action?
We need a mindset shift.
Right.
I know it is difficult to do. I know we are not willing to leave our comfort zone. But unless we change the way we approach the world, the way we live, behave, eat, etc., we are not going to make changes. What we need to do is realizing that we are probably too old to change our mindset, we need to work with universities, schools, etc., to prepare the next generation on the way they need to look into the world and they need to live, protect the environment, and then have different lifestyle, number one. Number two, I think we shouldn't be tackling big problems on sequential basis just because they are difficult. If we don't tackle non-communicable diseases today, when are we going to do it? So the notion that we need to be evolving on an incremental basis because this issue is too complex, too difficult, let's do this and then we come back to this, is part of the problem we find ourselves in today. We need to understand that unless we work on difficult issues at the same time, because they are interconnected and interrelated and mutually reinforcing, we will not be able to address the most difficult issues of our time. And then finally, I understand there is a session with young people happening in another room. And this is part of the silos that we ourselves create. We want young people to do, learn from our mistakes and do better, but they have their conversations in a different room as we do. The same way the ministries of health and the municipalities don't plan at the same time in the same room as if they were not part of the same government because of the way we, the global or the regional environments have make them plan in different cycles, in different moments, because the monies come at different times, at different moments. The summits happen at different times in separate cities and rooms, and then we expect integration at the end of the day. That's difficult. Thank you.
Very good, yeah. We need better succession planning for, well, certainly for me anyway. Barbara.
I see that a lot of One Health change is already happening in different forms, at different levels, in different parts of the world. And what people really seem to enjoy and benefit from is when they can hear from others about what they are doing, the successes that they have, the problems that they have, the failures that they have, and really have this exchange and learning and sharing. However, it goes back to what you said. We are sitting here in silos instead of having the youth in the same room, and I think that is happening with very many communities around the world, that we do not have enough of these shared learning and exchange spaces. So I think that is one important aspect to work on, so that the people who are working on One Health, who have experiences to share, that they can actually find a space to do that and do that effectively, and thereby generate value for all. The other point I want to make is that very often I see that if One Health is done in a positive, forward-looking way, that it gives people hope, and that it also helps people to maybe imagine a different way of doing things, imagine a different future, and that is also something that seems to be happening in some of the communities, that instead of looking at how can we act in the current system with all the barriers that we have, look forward into a differently imagined future. And there are some interesting dynamics or progress happening in that space that could also be useful here.
Thanks, Barbara. Christian.
Yes, I can't agree more with you. I'm actually very optimistic, right? And I see the change that has happened in the years that we've been meeting and talking about One Health. 15 years ago, this would have been unthinkable, really. It's a difficult journey, it's complex. We need a systems-based approach. We need to understand how systems work. We need to also appreciate and acknowledge that we are part of that system. I think we waste a lot of energy and time reflecting on systems as if we weren't part of them, or actually being the main driver. So as a representative here, so to say, for the environmental sector, which is obviously underrepresented as always, I do want to point out, though, it's not only about communities and humans and so on, it's about a lot more. And the most important thing to understand is that the environment, the wildlife they're in, and everything that's in that environment, which we share and of which we are part of, is foundational. It's not an option, it's not something you can just have if you want it, and it's not a danger, as was also mentioned earlier on today. It's not dangerous per se, it's foundational for our health and for the health of all. And if we do not understand that and have a different way of looking at the future, we will continue doing something which I'm stealing from an author, and I can't remember his name, so my apologies. But while we talk about decolonizing the past all the time, we are absolutely colonizing the future all the time. And it's the NCDs, it's the ecotoxicology, everything, the PFAS, the AMR, and so on. We need to stop doing that, and we need to get that message across to those decision makers who are driven by these short-term cycles.
Thank you, Christian. Andrew, quickly.
I'll be fast. Fully agree. I think we need to come from top-down and bottom-up. So basically, policymakers are in the middle. They need to they need to have some sort of shared knowledge. I don't like the word educate, but we need to share our knowledge on One Health, literacy and competency with them. However, top-down without political will, no chance. And you can see that it's actually dropping off. One Health, which should be part of global health, it's dropping off the nation and the government's agendas. This is why this why a conference like this is just absolutely needed in this day and age. So, but bottom up is civil society, advocacy for the cause, and putting pressure on the politicians. So that is, I think, hopefully that we can move faster.
Very good. I'm going to come to the audience now, and our first intervention from the audience is going to come from Priya Basu, who is the Executive Head of the Pandemic Fund hosted by the World Bank. Priya, are you here? Fantastic. Let's get a microphone to you, and then we look forward to your reflections on the role of the Pandemic Fund.
Thank you very much, and that was a very interesting discussion. So you asked a question, how can we accelerate action? So with your permission, I'll just make a brief comment. I mean, I do believe that financing matters, but more than financing, it's really political commitment, it's the alignment of stakeholders, it's ensuring that everyone works together at the global, regional, and national level. And when I say everyone, I mean across different arms of government, but also across stakeholder groups representing kind of human health, animal health, wildlife, livestock, etc. And we're seeing a lot of demand and a lot of interest from low and middle income countries whom we serve to take a One Health approach. We're a country-led fund. The first time round when we announced a call for proposals, we were pleasantly surprised that about 99% of the proposals that we got from low and middle income countries incorporated One Health into the project design. And along the way, we now have an $11.5 billion portfolio across 128 low and middle income countries in 6 geographic regions. And I would say that 95% of these programs that we're supporting take a One Health approach. And what does it mean? Sitting here in Lyon, it could sound academic, but actually on the ground, these are projects where ministries of health, finance, agriculture, environment, livestock, animal husbandry are working together. They're bringing community groups. We are training, not just doctors, nurses, and community health workers, but veterinarians, livestock farmers, park rangers. When we strengthen laboratories, we are looking not only at human laboratories, but at veterinary laboratories and connecting those two. When we talk about surveillance, we're investing in surveillance of wildlife, of livestock, of people, and connecting all of that. So on the ground, it's really a question, I would say, of political will and of commitment and of different stakeholders willing to work together. So I'm optimistic that we can translate One Health into policy, into action, and we're already beginning to do that at the Pandemic Fund. So thank you.
Priya, fantastic. Thank you very much indeed. Carlos, what questions have we got?
We have received a few ones, and since for once I don't have to answer them, I can choose the spicy ones. And I'll start with food systems. Can you address the impact of conventional food systems on human and planetary health? For example, how pesticide use focus on a handful of crops and are a double duty aggressing?
Go on, pick one of them. Choose one of them. Christian's going to go for it.
Yeah.
That was a really long question. I'm trying to... So I think one of the way I'm going to answer this, and this is obviously not my expertise, but in some of the areas we work, this is really a huge issue. And it's about the compounding impacts, actually. So one of the things that we have noticed, for example, is that in areas where we work with mercury contamination, for example, so because of gold mining, there's a lot of mercury contamination happening in massive scales all across South America, Africa, everywhere. But one of the interesting things is that fish that riverine communities depend on that are living in contaminated waters, their nutritional value decreases. And suddenly you're impacting the livelihoods of those communities that were talked about. So you have this whole cascade. You have the gold which is being extracted legally, illegally, contaminating the rivers, that is then impacting the communities that live there. And obviously mostly they're indigenous and disenfranchised communities. Now, I assume those cascades happen in all other food production systems that we have, either with ecotoxicology, AMR, and so on. It was an attempt.
Thank you. No. I found here two more, one on politics and one on education. So let's start with the politics. Science evidence is increasingly being ignored in political decision-making. Are more demonstrations of the cost-benefit of One Health still needed? What else could be brought to decision makers? And I guess to speed up science advice uptaking.
Ariane, do you want to have a go at that one?
No, what I would like to say is that awareness is something very important. The behavior of people, we have already spoken about that. It's essential. So here today, we all know what it is about One Health and AMR. I told my friends I'm going to a One Health conference speaking about AMR. My friends have all done university, are quite well aware of many things, but I had to explain. So I think really awareness, education, we spoke about that, having young people on board with us will make the difference. As long as people do not understand, do not see what it means, they will not change. And we know that politicians are elected by people. So there it starts. So I think if people are not convinced about how a One Health approach can make their life better, the next step is difficult to maintain as well.
I couldn't agree more. And this really comes down or boils down to One Health citizenry that is really important to foster from the very beginning. So kindergarten, that was the analogy, right? Who fell in the potion very
Obelix in the cauldron.
Very early on. So this is One Health citizenry that can push for that political will, hopefully.
There's one more here that, and we spoke today about these social ecological systems and social economy. So this perhaps is an interesting one. Setting priorities in a One Health approach needs to assess externalities, both impacts and benefits, in time and in different fields. How could and should a socio-economic analysis help to make the future more easy to choose from?
Yeah. I think that's a very common question that we face in One Health, because One Health really changes the lens. So what is to be considered an externality once we use the One Health approach, the externality becomes part of the wider system that we're looking at. So very often then it becomes internalized in the analysis. So if we continue doing that, if we continue shifting our lens for our economic analysis, then we will have more information. We will also have more information about, hopefully, long-term effects, in particular if you're looking at these effects in a system, and can, for example, include it in scenario analyses. And this is already happening. So we probably need more of that. Well, maybe. That's, I think, one of the points that we're discussing here, but it's definitely possible, and it is, I think, at the heart of One Health economic analysis.
Very good. We're going to have to draw the session to a close in a few minutes, so I'm going to give you a chance, 30 seconds each. One final inspirational comment to the audience to make them leave this convention centre inspired and optimistic about the future for One Health. Carlos.
Well, in 30 seconds, I would say, back to my story, you may leave Lyon, you may leave this conference, but you should not leave the village. So please connect, and together, again, I will say, we will be stronger.
We will. Andrea.
Please do take an hour of your time and go and read the Lancet One Health Commission recommendations.
Well said.
You knew that, right?
Well, even if it's just the executive summary. Christian.
Yeah, not wanting to pander further to the Lancet, but I do want to use as my final statement, because it was a great 2025 editorial that pointed out protecting nature, conserving nature, is a primary medical intervention in itself, and I want you to remember that when you get out of here. It is not optional.
Not optional. Brilliant. Barbara.
If you're looking for inspiration, talk to youth who have been trained in One Health. These people have fantastic ideas, they have motivation, they are enthusiastic, and it's a joy to talk to them.
Thank you. Magda.
and talk to them in spaces and places where they are on TikTok, they are on social media, those are the places where they need to listen to us. We need to move with our times if we want to leave the planet for our children. We need to go and meet them where they are. We are writing blogs, we are holding conferences. All these are important moments for us to have conversations and then agree on the way forward. But we need to meet the young people where they are.
Fantastic. Ariane.
Yes, and with Asterix in Lyon, the comics, I would like to buy it, and I can offer one of these three together, so you have it all.
Fantastic. And my last message is engage the media. We can be your friend and ally. I know we sometimes appear hostile, and sometimes we are hostile, but we want to be part of this movement. We can be a tool for accountability. We can hold those with power accountable for their promises and commitments. So work with us, and together we can make a difference. Give a big round of applause to this panel. Thank you.
Thank you all very much, and thank you, Richard, for waking up the audience for the final stretch. So, ladies and gentlemen, you've been hearing about recommendations throughout the day, and you have voted on them, and as has been said, you will hear about the outcome, but we will, before that, hear from the European Commission and from the quadripartite what their take on the recommendations is and how they think we should be going forward. To lead us through this discussion, it's a pleasure to welcome some of the key actors behind this event. So please welcome Thierry Lefrançois from CIRAD and Eric Cardinal from ANSES.
Well, we are really happy to spend this day with all of you. I hope you are not too tired, and I hope you are still enjoying your day, right? Yes. Okay, thank you. And so, well, we are really happy to moderate this very last roundtable of the day and to hear from the European Union and also the quadripartite on all those recommendations. And that's why we would like to invite to the stage, first of all, Pilar Aguar Fernandez, from the European Union, Director of Animal Production and Health Division, and Chief Veterinarian. No. Director for People, Health and Society. That's better. From DGRTD. Secondly, this time that's a good guy. I mean, Tien Sin Tanawat. I mean, the Director for Animal Production and Health Division, and Chief Veterinarian from FAO. Thank you. Please, Sylvie Briand, Chief Scientist from the WHO. Please come on stage. And I would also like to welcome Baba Soumaré, who is the Deputy Director General of Global Framework and Capacity Building from WOA. And finally, but not the least, Julian Blanc, the Head of Biodiversity and Land Branch Ecosystem Division from UNEP. And we will start by giving you a very quick feedback on the recommendation you voted for all this day. Please, Thierry.
Yeah, so thank you to all, and thank you to the panelists to be with us for the last conclusion and way forward session. As you know, we have been preparing this conference and the recommendation for the last 3 months, and we have been organizing working groups to develop recommendations for the policymaker for tomorrow especially. And these working groups have been working on the 4 thematic areas of the summit, plus on the cross-cutting issue related to data, social sciences, and governance. And the audience has been voting during the whole day for their preferred recommendation. I will not enter in all the recommendations that were chosen because it will be too long, but I will just give you some example related to the 4 thematic areas. For emerging and re-emerging infectious diseases, the winner is the recommendation 2, which is support One Health surveillance and prevention systems through a science-state-society dialogue. For antimicrobial resistance, the winner is the recommendation 6, which is related to integrating agricultural systems, including livestock, aquaculture, crop production, and value chain into antimicrobial resistance strategy. For pollution, it was too difficult to choose between 2 of the recommendations, so I merged the 2. It's develop mitigation strategies and reduce pollution at source, and support socio-economic transitions, including agroecological practices. And to finish, for sustainable food system, again, 2 main recommendations were chosen. One is to promote agroecological systems, value indigenous and local knowledge, and develop frameworks for ecosystem service payment. And the second one was to preserve biodiversity in food system, conserve and valorize local resources. So you have just a flavor of the main recommendation chosen by the audience, and then we'll give you the floor.
Thank you, Thierry. So thanks to the recommendation, you can react as you want, up to you. And we'll start by you, and you shoot first, Pilar. So please, could you please share your perspectives on those scientific recommendations discussed throughout the day, and clarify how DGRTD evaluates all those recommendations within the framework of the European Union One Health strategy.
Thank you very much, and thank you for giving me the opportunity to be here today and in this important summit, and having put in this topic, the One Health topic, on the agenda of the Health of State, because it's really amazing. So, and I think it is important because we are really at the moment where we need, more than ever, perhaps, these integrated, evidence-based approaches to health. So when you are in the last panel like me, your notes look like this. Scratch, scratch, scratch. New notes, because everything that has been said in here, it has really made a profound effect on all my notes and what I want to share with you guys. So, of course, zoonosis, antimicrobial resistance, the biodiversity loss, climate change, they are a threat, not only to the health of millions of people, but to the health of millions of animals, to our ecosystems, to our planet, just to mention the planet again. So indeed, we know that these are very complex issues that cannot be tackled only by a single community, and that need really to be addressed by science, by research, funding, because really funding is important for these, and also by political decisions that are really committed to the long-term strategies. So this is something pretty important, and using those in an interdisciplinary manner and transdisciplinary cooperation. So actually, I had taken my notes here, and I agree with your 4 pillars, but to the cross-cutting issues, I would say there are in reality 3, not 4, because I've noticed data that need to be there. We need to it's the fuel for research, but they're not accessible, they're scattered, they are still missing. So that's something where actually research can support that. The SSH integration, absolutely crucial. So human, society-centered research that brings in the societal engagement to make sure that we do the behavioral change, and actually something that is important because the uptake of solutions need to be done in this way. And that's something that we are working. Governance, that has been mentioned, bringing together all the actors at the different levels, in different places, with different backgrounds and different necessities, but also different knowledge. And that is something that I think research can also bring that people together. And the 4th thing, the climate change, work on climate change that actually exacerbated most of the One Health issues that have been identified. So for me, the lesson learned, in a way, it's think globally, but tailor it, act locally. So that's something that I'm pretty impressed with. Now, we have, and thank you, Bruno, for making my life easier. We started working in research, funding One Health research 20 years ago. But in July 25, we actually had the EU Life Science Strategy, where we committed, and it's in the words of the European Commission, to promote One Health approach in research and innovation. And I think this is a very strong word in that we really have to live by. And for me, it is a privilege and a pleasure to be working in the European Union and being responsible in part of it for the Horizon Europe, so for the framework program for research and innovation. And it's not only a European research and innovation program, because it's really open to the world. We have associated countries that are very important partners for us. Canada, Japan will soon be, Korea, Singapore, New Zealand, and all of these actors are actively together with us promoting One Health activities. We provide funds for a lot of researchers from Armenia to Uganda, from Bolivia to Sri Lanka, from Honduras to Indonesia, to work on these matters that matter to all of us. And I think that for us, the most important thing is the value, not on research funding as such, a project here, a project there, but the partnerships. The partnerships bring added value. In there we have not only alignment of funding, and all the funding is in there, but also the strategic research agendas. And those are public-public with not only the European countries, but also other countries. And I want to mention the partnership on antimicrobial resistant One Health, Be Ready with France at the helm, the multilateral initiative on health and climate change, the animal health and welfare initiative. All of those are partnerships with an important amount of funding, where a number of important countries come together with us, and we decide together what are going to be the next year's primarily important research funding priorities. And I think this is important. We also have the European clinical trials partnership with African countries, where we do also this research on new antimicrobials, for example, of something that we're very, very proud of. But let me say something to the few people that is here from the industry. I think it is important to also say about the public-private initiatives, where we partner with industry that can bring together new molecules, new technologies for surveillance, or new production practices. So this is the past. What I'm going to do in the future? Very simple. So in the future, we are going to have the new partnership on NAMs that is going to be presented pretty soon. Our partnerships are going to be working for the next years. And if I may say so, we are in the preparatory phase for the new framework program that will kick on in 2027. And discussions like the ones we are having today are going to inform the future priorities. So this is how we intend to get this information on board. Thank you very much.
Thank you very much, Pilar. Please, Jay.
Okay. Thank you. Dr. Tanawat, thank you for being there. Would you like to share the alignment of the FAO strategy and the recommendation that were presented today, and especially related to the transformation of food system that is required and requested by the scientists? So please share the strategy of FAO, please.
Thank you very much. From the previous panel discussions, I remember our moderators asked you the questions. When we leave Lyon this week, what we have to do? It's the same as this session, how we're going to translate recommendation into actions. Because all of you who come here in this plenary hall, you have a strong belief that One Health make a difference. And as the previous discussion also talking about how to work together. Together can make a difference. Because we have a strong belief that the One Health approach, it really makes something different from before. But we know that our policymakers, when you ask the question to your ministers, I'm sure that ministers may not give the right answer or right definition of One Health. Even though my Minister of Agriculture, because we come from the Food and Agriculture Organization, the Minister of Agriculture will ask, what is the One Health have to do in agriculture? And that's why today, if you remember very well, 20 years ago when we're talking about One Health, when we talk about One Health, we talk about infectious disease. We talk about avian influenza H5N1 that occurs 20 years ago in Asia. And just only last 5 years, when we have the big pandemic of COVID-19, it reminds us we need to work together, different sectors. But we know that when one of the speakers in previous session also mentioned, now we are shifting from the One Health in infectious disease or zoonotics, or even though the antimicrobial resistance to other issues, because we believe that the One Health approach can work together in multidisciplinaries to address the complex issues. It's not only zoonotic disease, it's not only infectious disease, but we also can address other complex issues, especially in FAO when we're talking about One Health in agri-food system. Because One Health in agri-food system, we're talking about One Health, how we're going to address the issue of soil health. Because when you use chemical pesticides, all the contaminations or residues will go to soil and waters, and at the end will come to our health. And at the same time, when you're talking about plant health, if you want to have a good plant production, you need a soil health. And that's why the plant productions and plant protection is a part of One Health, that we can also address these issues using the One Health approach. And then when you're talking about animal health, animal husbandry, as my colleague from Pandemic Fund already mentioned, because the issues that if you want to have to protect the health of animals, you also need to improve biosecurity, you need to improve animal husbandries. I just returned from Vietnam and Indonesia. I can give you an example. I remember Carlos also talking about village, that we need to connect the silo, that we need to build the bridge. Because at the village level, all the people in the village, they know each other. I can give you an example. When you have the chicken farms, if you want to make sure that you don't get the disease, you need to improve biosecurity. You need to improve the animal production or livestock production. But in that village in Vietnam, next door is the forest. And that's why some disease can come from the forest. But at the same time, when you have chicken farm in the village, sometimes people in the village, they don't like smell, they don't like the bad odors. How are you going to make sure that you can address those issues? But when you have the chicken manuals, if you don't manage carefully, it also can have an impact to people in the village. And that's why you can see that all the issues is connected, from plant health, soil health, animal health, food safety, clean air and waters, and pollution. And that's why all the issues, once we see the connections, and everyone in the societies, in their communities, even though when you're talking at the national cabinet or the government, every ministry have its own role. But when you're talking at the global level, when you're talking with the quadripartite, to make sure that each organization also have its own mandate, that they can make contribution. It's not only bring 4 or 5 local and say this one is One Health. One Health is beyond quadripartite. One Health is about bring everyone to address the complex issues together. It's not everyone have to go everywhere at the same time. When you have trust, you also would like to work together. When you can tolerate each other, you also can work together. When you respect each other, you also can work together. When also you have reciprocity, you also would like to work with others. And that's why the 2R and 2T that I mentioned bring us to work together under the One Health concept. Thank you very much.
Thank you.
Sylvie, your turn. Could you share with us, your reflection about all these recommendations, and particularly I would like to come back on one specific one about, how to strengthen, prevention in the healthcare systems, but also at the same time at human, wildlife, environmental interfaces. Your turn.
Okay, thank you very much for inviting me to this panel and for your question as well. I think the recommendation really presented an outline of a very comprehensive and ambitious integrated One Health ecosystem. And this resonates very much with WHO's priorities. But there are things we are already doing, but there are things we need to do more in the future. So I think that's why this type of event is so important. One thing that resonates really with those recommendations is the emphasis on multi-sectoral governance and how we institutionalize this governance. Because I remember I used to be director of pandemic and epidemic disease at WHO many years ago, and I was part of the tripartite at that time. Now it's very nice because we have a quadripartite, and so it has survived. But I think we need also to have consistent coordination across sector, not only episodically when we have a crisis or after a pandemic, but really maintain those infrastructure and institutionalize structure for a long time, because it takes time to make change. So we need to work steadily on those recommendations. There was also in this recommendation a strong focus on prevention, and this is really a philosophical but also a strategic pivot. WHO has been championing for many years. And I agree with Magda, it's a mindset shift from diseases to people. But at the same time, I think it's also, it requires also a budget line. It requires a political priority, and I'm very happy that this summit is really putting One Health at the political level, where it needs to be as well. And also, it requires measurable incomes, and we have talked about it when we talk about data. How can we measure One Health successes? But I think prevention is still seen as a cost, and it should be seen rather as an investment in resilience and for the protection of future generation. And I think so far we have not made the right advocacy for it. So I think we should continue to work together to have the right pitch for prevention. Then on the operational pillars, there have been many recommendations on emerging infectious disease, AMR, pollution, and sustainable food system. So I think this is really crucial for the work on the health sector. And I just would like to mention, for instance, if you take the chronic diseases due to pollution, especially air pollution, plus all the direct related chronic diseases linked to our lifestyles, you have a direct impact, of course, on the health of the people with all those NCDs, and it has also an impact on health system because it is a huge cost. But moreover, I mean, the rise of chronic diseases means that also an increase in high-risk groups. And so in case of a pandemic or AMR emergence, these will be those groups that will be primarily affected. So all these sectors are really interconnected. And I think it's really important to realize the interconnectedness also of the crisis we are facing. And fostering integration across this domain requires, as I agree, really a structural transformation. And so I hope that after this summit, we will think really about what we can do in addition to these incremental changes and modification we have been doing over the past 20 years. What else can we do now to make sure that a real change happens quickly? I would like also to talk a little bit about these cross-cutting foundations that are really important, data and social science. On data, WHO has been already investing a lot in federated data system, in interoperable surveillance framework and collaborative intelligence. And I would like to mention, for instance, OFLU, which is a system of networks of laboratories sharing data on influenza that are really contributing to the development of seasonal influenza vaccine, but also on the assessment of the influenza pandemic risk. So these are very concrete collaboration. But I think we need to go further. Now with AI, with all what is happening, and soon quantum technologies, I think we need really to look at the future and really anticipate future changes in the way we manage data, and we collect data and analyze data so that we can be ready for this technological revolution with anticipatory governance and not lag behind and make changes when it's already there and we are too late. And on social science, I think it's very important. I mean, we have worked a lot on community engagement, behavioral insight, ethics, but this must be scaled up. My own experience, professional experience, because I've been advocating a lot for community engagement during outbreak responses. It's every outbreak we set up a team to do this, and after the outbreak, the team is dismantled. There is no funding for it. So I think it's really important that we continue to push for social science, and because without trust, behavioral insight, and local ownership, I think no technical solution will be sustainable, and it will not translate into impact. So social sciences cannot be an add-on that you add when you are in the midst of a crisis, for instance, but they really need to shape and the design and the implementation and evaluation of all One Health interventions. So thank you very much.
Thank you so much. And Dr. Babas-Murray, perhaps you could share also same question, the reflection of WOHA, and especially perhaps on one specific question related to integrated surveillance within the different systems, human health, animal health, and ecosystem.
Thank you very much. Indeed, most recommendation speaks very much and align very much with WOHA. And as you know, WOHA's mandate is to strengthen animal health and animal welfare. And to be able to have, it was talked a lot about seeing One Health happen and having an impact. And it would be hard to imagine that happen without competent veterinary services, without adequate investment in animal health systems. And I think one of the recommendations emphasize a lot the prevention at source, focusing on primary prevention at the animal-human environment interface for us is key. And it speaks directly to WOHA's mandate that I mentioned earlier. So for us, really, ensuring both public health, animal health have the adequate capacity will be necessary to see that integrated surveillance at country level. Another important aspect to enable that integrated surveillance is really integrated is through data sharing. This is very, very important for us. So we strongly support the call to leverage science, data, and innovation. We believe indeed that integrated surveillance and operable systems are essential. WAHAS promotes use and sharing of data, starting with transparency. We strongly encourage members to notify disease so that at all time information can be shared with other members, which allow them to step up, they're vigilant to step up their biosecurity and their preventive measures. WAHAS manage a vast network of scientific institutions, which facilitate the generation, access, and sharing of science to inform standard settings. We work very rigorously to ensure that the guidelines and science and standard we are developing, they are rooted on science. That scientific network and the information and data generated as informing decision-making as well, as informing policy. And it is a key alignment to WAHA. We also foster strong networking of scientific collaboration, bringing together leading One Health and research institutions. And on another integrated collaboration aspect is, of course, our work on antimicrobial resistance. This is also very important. We work closely with FAO to strengthen the stewardship on antimicrobials, to monitor the use of antimicrobials, but also to ensure adequate access to quality antimicrobial, to quality vaccines, which are key to enable prevention. And we see there's, again, a great venue for collaboration, sharing knowledge, sharing science, sharing tools, sharing expertise across sectors to be able to facilitate that one. WAHA believe that we need to be able to do a better job in financing the cross-sectoral priorities in financing One Health. And it was emphasized in previous panels, the need to continue generating evidence. The work that was done, initiated, led by OLEP on the One Health economics and any other evidence generation need to be strengthened, need to be funded. But then the evidence need to be effectively used to support advocacy, to help decision makers decide why should we invest in One Health. What is the added value? I think this is very important. So WAHA is very much working within the quadripartite to position the One Health outcomes, the One Health priorities in international agendas, such as the climate, such as other priorities, pandemic prevention, etc., etc. So I think we need to align all those major priorities to be able to strongly make a case of why we should invest in One Health. I could go on, but I think, yes.
Thank you, Baba. I mean, pretty clear. So, dear Julian, we also want to hear from you. What could be your opinion on those recommendations? And do you think, they can feed the UNEP strategy? And do you think, those recommendations could be useful, you know, with global agreements like, you know, global framework on chemicals, or, of course, the plastic treaty?
Thank you very much. So, yeah, I mean, I think the recommendations in general, they all make a lot of sense. In fact, we've probably, as we've heard before in the previous panel, many of them probably already existed in different forms. They're nothing new. We know we have to do these things, but the fact of the matter, as we've heard today, is we're still not doing it. We keep hearing we need to move One Health from concept to action, but we're still not quite getting there. So I think it would be really important to actually dig in a bit deeper as to why we're not turning One Health into action at the scale that we need to turn it. What is it? I mean, we've heard, of course, money is very important and there's never enough, and usually things are projects which are short-term projects. We need longer investment, etc. Governance is really important. We need to improve the governance, but I think there's something deeper about human behavior, both as individuals and as groups, that is probably preventing us. This speaks to the silos, of course, which we know we need to bridge. We know we need to bridge the silos, but do we know how to bridge the silos effectively? And I think that's, I mean, it speaks to the need for deeper behavioral research and better applied behavioral research as to what is it that drives our behavior ultimately, as I say, as individual and as a society. I think there is a lot of it that is biologically determined, and no matter how much we talk about it in our social sphere, there are things that we cannot easily change, and we have to find new ways of changing those behaviors. One example, of course, which has been talked about today, is we tend to value short-term gains over long-term costs, right? How do you get over that? We all do it. We all discount the future. I offer you $100 today or 1,000 in 5 years' time. I'll take the 100 today, right? That is an example of us discounting the future. So that behavior, that human behavior at both the individual and the societal level, is something that I think is great to see it here reflected in this panel. And I mean, in this conference, but I think we need to go far beyond that and not talk about data. I mean, of course, we do need to talk about data, but actually get into the depth of human behavior. So I think that will be critical to success in One Health. So the other question, of course, is about, we've heard also about the need to have mindset shifts. And again, those mindset shifts really is about societal values. What does society value the most? And very often we find, for example, unfortunately, the environment is an example of that. The society tends not to value the environment. Environmental degradation, we euphemistically call it a negative externality, but we let it go in favor of economic benefit. In our society, we tend to privatize costs and socialize benefits. And unless we address those things, it's the economic system that we live in that forces us to do those things. Unless we sort of get into the nitty-gritty of that, we're never going to be able to move forward with the One Health agenda enough, to bring it to scale. In that sense, also, I think that science and evidence are super important, but they're not enough. Even the science policy interface is not enough, and Magda has talked about this. I couldn't agree her with more. We also get into the political space. We also know that political cycles are short-term by definition in democracies. So how do you break that short-termism when every 4 years you're going to have potentially a different government, right? So those are big questions, much bigger than surveillance, et cetera, but I do think we need to address them if we're going to succeed in this space. And I think there is hope, but we just need to invest in that behavioral research for both individuals and groups. I'll leave it there. Thank you.
Thank you so much. And before we leave for the conclusion session, please, could you share with us one keyword you would like us not to forget when we leave Lyon?
Cooperation. Cooperation.
When you arrive at your home country, at your office, take action immediately.
Don't forget that tomorrow is the World Health Day, and the theme this year is Together for Health, Stand with Science. So together.
Invest in veterinary service, share science, access science.
I would say broaden the One Health approach beyond zoonotic disease and AMR. We're seeing it with pollution, etc., but to a much broader scope to look at the health of the environment for its own health and how it affects the health of people and animals, etc., etc.
You can applaud our panelists.
Well, thank you all very much for your contributions and for your key takeaways. Ladies and gentlemen, the time has come to wrap up our session and pick up on the key takeaways, but maybe also open a window onto tomorrow's event. And to do so, it's my pleasure to welcome the Director General of FAO. Please welcome Mr. Koo Dong-yu, who's also the current President of the Quadripartite. Please, sir.
Excellencies, ladies and gentlemen, and the honorable host from France. And it's a great honor for me to stand in front of you after listening a little bit of debate. I got a sense, not a science, it's a sense, which we needed to understand what the real One Health first. Of course, a lot of people from outside consider science, health is related to the WHO. Not enough. They are not the only one, the organization related to health. In my opinion, the One Health starts from health of the water, soil, and air. Without these three basic things, nobody, no animals, no plants can be healthily grown and the evolution even. That's, in somehow I understood, I agree with colleagues from UAB. We need a deep thinking first. If we only have the phenomenal description, you always talk about the very general things. And then you said you have a solution. What kind of solution you are aiming for? So that's my impression. We need at least 4 partners or quadripartites or what others, even IIEA. We have the joint center with IIEA 62 years ago. How do you say atomic technology to fix the problem for agrofood systems? Related to the soil, related to the radiation breeding program, related to control the Mediterranean fruit fly. So we need all the partners, innovations, possible technical approach to work together. That's my first impression. This summit started with the first day of the science debate, professional discussion. I think it's a good entry point. Of course, I appreciate that the French government, especially President Macron, put the political willingness and the commitment. One Health, first from number 1 person to show their real political commitment. Otherwise, all the technical, you are talking about AMR or zoonotic disease, so many years. Yeah? You are always aiming, we call the karaoke. You sing a song by yourself and the market by yourself. That's the game started in Japan many years ago in music. You sing a song in karaoke. I don't know, some of you have experienced. Everyone become a superstar because after singing a song, you give your own mark. That's a karaoke. I challenge my colleague from FO, don't be karaoke player. You should go first, challenger from outside. First, we need a challenge from politicians. Why is it so important? Answer the question which you understood, you couldn't understand your technical. But the politician, I think they're smart. The most powerful people on this planet. they have power, they have resources. If they understood, they're willing to support you. So political commitment is number one. Number two, we need a package of solution, not a single solution. You always debate among the AMR, zoonotic disease. There's no solution. Since I came to FAO as a DG 2019, I said, if we only talk about the three-part test, only zoonotic disease, AMR, that's One Health. At least with the FAO mandate, we started to talk about the soil health and plant health. Without plant health, we don't have health food. We don't have health feed for animals. How can you have the health animal? I challenged my colleagues from Minister of Health. I said, every day, 90%, 100% people eat food. We need the health food. Only 10% in the planet, they take the medicine. You build the health based on 10%, we are working for 100% population on this planet. No matter your minister, you're a billionaire. I joke with Bill Gates. You have money, you have food accessibility, affordability, but you didn't have the health food accessibility because you stay from one hotel to another. So we need real food availability, accessibility, affordability for health food from the ground, from the soil, from water. So that's we need a deep thinking and integrated approach. That's the second listening. A third one, we need action. But not only action by farmers, by smallholder farmers, by local communities. We need a holistic design from up, down, top to down, and down to up, to get a consensus, to work in a coherent way. We need a critical scientist. But once we decide that we should work together, so all the partners, from the investors, from the scientists, from the non-government organizations, and to all these partners work together, from the field to the fork. That's last one, as an international organization, we should science-based, data-based. We should strengthen our normative work. That's we build a consensus with our compromise. As a Chinese supervisor says, you agree, we disagree. And then you get a real consensus. Let's work together as a good partner, as a responsible partner, as a coherent action facilitate. Thank you. Thank you so much.
Thank you very much, Mr. Director General. Ladies and gentlemen, I'm now delighted to give the floor to the French Minister for Higher Education, Research and Space. Please welcome Mr. Philippe Baptiste.
Monsieur Dongui-Chu, Monsieur le Directeur Général de la FAO, ladies and gentlemen, the excellencies, distinguished scientists, dear colleagues, I am very happy to be here today, and as we come very close to the end of this scientific meeting on the One Health Summit, I would like to express my sincere gratitude to all those of you who have made this day of dialogue possible and who have allowed us to share all this reflection and all this material that has been presented. Thank you first to Monsieur Dongui-Chu for being here and for your commitment to advancing the One Health agenda. I would also like to thank the almost 300 French and international experts who have worked over the past months to prepare this conference and to develop the recommendations that have been discussed today in this room. Your dedication illustrates that science and scientific cooperation across borders is essential to address the complex health challenge of our time. My gratitude also goes to the team of the French Ministry of Higher Education and Research. I know that they have been working very hard on this, and a special thanks to CIRAD and to ANSES, who have been really working hard on this conference. And finally, I want to wish I wish to thank all the speakers and panelists who have shared that knowledge. This colloquium reminded us once again of the importance of science in order to build policies that are meaningful, that are effective and grounded in evidence. I am a scientist myself, and I really strongly believe in that. I mean, science is a key pillar of policymaking and of democracy. In order to help our societies to anticipate risk rather than merely react to crises. And this is, of course, very true in the field of One Health. Few areas illustrate as clearly the profound connection between scientific knowledge, public policies, and the well-being of our societies. The health of humans, of animals, of ecosystems, and of environment cannot be understood or protected in isolation. They are deeply interconnected. At a time when in some parts of the world the very idea of science is being challenged, at a time when academic freedoms sometimes face pressures or setbacks, gatherings like this one are more important than ever. These events reaffirm our collective commitment to knowledge, to science, to open dialogue, and to international cooperation. Over the day, your exchange has produced a number of key messages and takeaways that deserve to be highlighted. First, this process of scientific consultation demonstrates the value of collective expertise. No single discipline, institution, or country can solve this challenge alone. Second, it's now very clear that we can no longer treat human health, animal health, and environmental health as separate components. Siloed approaches of the past are not only inefficient, they generate unintended consequences. By contrast, actions that are taken to protect one dimension of health often generate co-benefits for others, while also supporting climate stability and biodiversity preservation. In other words, One Health is no longer an academic concept, it's a scientific imperative, a practical framework, and a political policy for global resilience. Another important lesson from this conference is that the challenge we face are, as I mentioned before, interconnected. Emerging infectious disease, antimicrobial resistance, pollution, and unsustainable food systems cannot be addressed separately. Many of the recommendations discussed here cut across these themes and call for transformative change in the way we balance human, animal, and environmental health. And perhaps most importantly, the discussions have highlighted the urgent need to move from reactive tools to crisis management to proactive and unified primary prevention. For the research community, this transformation has several very concrete implications. First, we must strengthen the co-construction of knowledge with all stakeholders at the same time. This means integrating not only biomedical and environmental science, but also social science and humanities. Understanding behaviors, institutions, and social dynamics are essential if we want scientific knowledge to translate into effective public policies. Second, We must improve the sharing and the use of data. Breaking down the fragmentation of data system is crucial to enable integrated analysis. Promoting interoperability, including through fair standards, will allow researchers and policymakers to generate actionable insights while respecting national sovereignty and ethical framework. Third, we must continue to reinforce international research initiatives by addressing key One Health challenge from emerging infectious disease and antimicrobial resistance to data infrastructures and the exoesposome. Initiatives such as PRESOD, we will discuss them a little bit later on, illustrate the value of global cooperation in anticipating and preventing zoonotic risk. Fourth, we must strengthen education and training in One Health across discipline. And finally, we must ensure that researchers engage in interdisciplinary and integrated approach receive the academic recognition they deserve. This is not an easy topic, but we really have to work on that. Allow me to briefly highlight a few specific areas where the discussions of this conference have really pointed to concrete priorities. In the field of emerging disease, prevention must become our central strategy. This means studying the determinants of health, protecting ecosystems, and acting at the high-risk interface where humans, animals, and environmental dimension interact. Stopping zoonotic spillovers before they escalate into global crisis require integrated research, surveillance, and sustained investment, and France is committed to support this effort. For example, the construction of the new Pasteur Center dedicated to vector-borne disease will be completed next year and will strengthen our capacity to combat emerging infectious threats. Another major priority discussed during this colloquium is antimicrobial resistance. This silent pandemic strengthens the very foundation of modern medicine. Preserving the effectiveness of antimicrobial requires coordinated global action that includes human health systems, veterinary medicine, agriculture, and the environment. We must support the development of new antibiotics while ensuring responsible use across all sectors. In this sense, antimicrobials and their effectiveness should be regarded as a global public good whose preservation is key and is a shared responsibility. The issue of pollution also calls for renewed attention, evaluating the long-term impacts of new technologies before the deployment must become standard practice within a One Health perspective. Reducing plastic pollution is also very, very important. This vision drove the European Commission to adopt the 2021 Action Plan towards zero pollution for air, water, and soil, with the ultimate goal of fostering a toxic-free environment. And France is, of course, fully committed to this ambition. Finally, the transformation of food systems is essential. Sustainable food systems must reconcile human health, environmental protection, climate objective, and biodiversity preservation. Strengthening the links between agroecology and the One Health approach offers promising pathways to achieve this balance. And we are supporting several initiatives in this field. Among them is the 120 project coordinated by Institut de Recherche pour le Développement and supported by the French Global Environment Facility, which aims to reduce pesticide use in the tropical Andes, a global hotspot of agrotoxics. Across all these areas, one cross-cutting issue stands out: governance. Institutionalizing the One Health approach at all levels will be essential, and I mean the local, national, and global level. In order to do this, we need robust data infrastructures, interdisciplinary cooperation, and sustainable financing mechanisms. But we also need the core values of One Health to remain central to the way we design policies and institutions. We need, again, interdisciplinary, inclusivity, and equity to be the backbone of our action. Allow me to conclude with two reflections. First, the question of justice must guide us. The voice of vulnerable populations, the specificities of territories, and the knowledge held by indigenous and local communities must be fully integrated into our own decision-making processes. Second, we must act with a profound sense of intergenerational responsibility. Protecting the ecological foundation of life today is first and foremost a condition for safeguarding the health of future generations. Ladies and gentlemen, the One Health approach is an invitation to address problems in a new way. It's not so much a choice as a necessity, made more visible every day by the complexity of the challenge that we are facing. It is now our responsibility as policymakers, as scientists, as institutions, and international partners to ensure that this knowledge translates into action. Thank you very much.
Thank you very much, Minister, for these encouraging concluding words. This is the end of a very fruitful and rich day. So, ladies and gentlemen, first of all, thank you very much for joining us and staying with us throughout the day. I'd like also to thank all our speakers during the day. And let's not forget the teams that have worked very hard in order to put together such a rich and dense program, and I believe they do deserve a big round of applause. I'd like also to thank our tech team and our interpreters for supporting us throughout today, so thank you. Ladies and gentlemen, I wish you a very nice evening in summery Lyon and make the most of tomorrow as well. Thank you very much. Bye-bye.